Everyone is on Ozempic right now, semaglutide, Wegovy, whatever your doctor is calling it. And I'm genuinely not here to debate whether you should or shouldn't be on it. That's between you and your provider. What I am here to talk about is the thing that nobody in the GLP-1 conversation is addressing, and it is driving med spas absolutely wild right now. Because the question isn't just what happens to your body when you lose weight fast. The question is, what happens to your face? And the answer has a name now: Ozempic face. Here's how I know this is real and not just a TikTok thing. Oprah Winfrey, the woman whose weight journey we have literally been watching for 4 decades, went on national television, looked directly into the camera, and confirmed she takes weight loss medication. Oprah. And she is not alone. Sharon Osbourne came out and said she lost too much weight on it, didn't love what it did to her appearance, and had to do additional work to get her face back. These are 2 women with unlimited resources, entire teams of professionals, and they are still publicly talking about the skin consequences. So if you are a regular person who lost weight on one of these medications and you're standing in front of the mirror thinking something looks off, you are not imagining it, and you are definitely not alone. Before I get into the actual science of what's happening and what fixes it, I want to say something real quick. This channel exists because I genuinely love this space, and I want to give you information that actually helps you make good decisions about your skin. Not scare you, not sell you anything, just inform you. If that has ever been valuable to you, the most meaningful thing you can do to help me keep making this content is hit that like button and subscribe. It costs you nothing, and it genuinely makes a difference for this channel. I appreciate every single one of you who does it. Okay, back to the faces. So, what is Ozempic face, and why is it happening to people who are otherwise thrilled with their results? GLP-1 medications suppress appetite aggressively, which creates a significant calorie deficit and rapid weight loss. The problem is that when you lose a large amount of weight in a short window of time, you lose fat everywhere, and that includes the fat in your face. Now, here's the part that surprises most people. Facial fat is not just cosmetic padding. It is structural support. It literally holds your skin up. Cheek fat, temple fat, the fat under your eyes, all of it is acting as scaffolding beneath the surface. When it disappears faster than your skin can adapt, the skin sags. It deflates. And you can look 5, even 10 years older than you did before the weight came off. Your jeans fit better and your face looks exhausted. That's the cruel part nobody warns you about. Oprah went on national television and confirmed she takes weight loss medication. Sharon Osbourne said she lost too much weight on it and had to do extra work to get her face back. These are women with unlimited budgets and full teams, and they are still talking about the skin fallout. So if you lost weight on a GLP-1 medication and something in your face looks off, you are not imagining it. There's actually a name for it: Ozempic face. And today we're getting into exactly what it is, why it happens, and what actually fixes it. Now, here is where the internet is getting this completely wrong, and it is genuinely frustrating to watch. The most common advice people are getting online is, stop taking the medication, gain a little weight back, and your face will return to normal. And while yes, weight fluctuation does affect facial volume, the framing completely misses what's actually happening at a skin level. Because it's not just about volume, it's about what rapid weight change does to your collagen and elastin, the proteins responsible for your skin's structure and bounce. When skin is stretched and then quickly deflated, those fibers get damaged. And if you are over 30, your body is already producing significantly less collagen than it did a decade ago. So telling someone to just gain 5 pounds back is like telling someone their house foundation cracked and suggesting they put a rug over it. The underlying structure has been compromised, and it needs actual treatment. This is exactly what Kim Kardashian, Jennifer Aniston, and Jennifer Lopez have quietly been doing for years. Not because of Ozempic specifically, but because they understand that maintaining skin quality as your body changes requires active intervention. Jennifer Aniston has said directly that she credits lasers and a great moisturizer for the way her skin looks. Kim Kardashian has been open about her laser sessions and RF treatments. J.Lo's ageless appearance is widely attributed to BBL laser and a disciplined lifestyle. These women are not banking on genetics alone. They are getting treatments that stimulate collagen production and remodel skin tissue at a structural level, which is precisely what Ozempic face needs. The most common thing people are told is, just gain a little weight back and your face will bounce back. And that's not the full picture. Rapid weight loss doesn't just remove volume, it damages the collagen and elastin that gives skin its structure. And if you're over 30, your body is already producing less of both. You can't just eat your way back to tight skin. What actually fixes it are treatments that work at a tissue level, stimulating collagen, rebuilding structure, and tightening what got loose. That's a very different conversation than most people are having. So what are those treatments, and why do they actually work? The two categories doing the most work right now for Ozempic face are radiofrequency microneedling and regenerative injectables. RF microneedling, Morpheus 8 is the most recognized name, delivers controlled heat through tiny needles deep into the skin and underlying fat layer. That heat triggers a wound healing response, which means your body starts producing fresh collagen and elastin to repair the area. The tissue physically tightens and remodels over the following weeks. It works on the face and the body, which matters because the skin laxity from rapid weight loss is rarely just a face problem. The second category is PRF, platelet-rich fibrin. Your own blood is drawn, spun in a centrifuge to isolate the growth factors, and injected back into the areas that need volume and collagen support. Because it's your own biology, the results look completely natural. No filler face, no pillow effect, just skin that looks like it quietly got its act together. Here's what a smart approach to Ozempic face actually looks like in practice, and what you should be asking about if you walk into a med spa. The starting point is always an honest assessment of what you're actually dealing with. Skin laxity and volume loss look similar, but respond to different treatments, and a good provider will tell you which one, or which combination, is driving what you're seeing. Skipping that conversation and jumping straight to filler is one of the most common mistakes people make, and it often creates results that look off because you've added volume without addressing the structural looseness underneath. If laxity is the primary issue, skin that's lost its tightness and definition, the focus should be on treatments that stimulate your skin's own collagen production. RF microneedling, laser resurfacing, BBL. The halo laser in particular is worth knowing about because it works on two levels simultaneously. It addresses surface texture and pigmentation while also driving deeper collagen stimulation. It's the kind of treatment that makes people ask what you've been doing differently, which is genuinely the best outcome. If volume loss is the primary issue, that hollowed out look under the eyes and through the cheeks, the conversation should start with regenerative options before defaulting to traditional filler. PRF Easy Gel uses your own growth factors to restore volume naturally over time. The aesthetic industry has moved significantly in this direction because the results are more natural. They integrate with your tissue instead of sitting on top of it, and there's no risk of the overfilled look that has become the thing everyone is trying to avoid right now. Start with an honest assessment before any treatment. Laxity and volume loss look similar but need different approaches. For laxity, RF microneedling, halo laser, BBL. For volume, ask about PRF before jumping to traditional filler. The industry has moved toward regenerative options that use your own biology. Better results, more natural, no filler face risk. A good provider will tell you exactly which one you need and why. That conversation is everything. For home support between treatments, the ingredients that matter most for skin dealing with structural loss are retinoids, still the most research-backed option for collagen remodeling, copper peptides, which have had a real renaissance lately for good reason, and growth factor serums. Medical-grade formulations from lines like Elastin Skincare and Skin Medica are genuinely in a different category than what you find at a regular retailer. Not because of marketing, but because of the concentration and delivery systems. If you've been spending on treatments and then going home to a basic drugstore moisturizer, you're leaving results on the table. If you haven't already subscribed, honestly, what are we waiting for? Hit that button and turn on notifications so you don't miss what's coming next. My question for you in the comments, have you noticed any changes in your skin after significant weight loss, whether from medication or anything else? I want to hear what your experience has been. Drop it below and I'll see you in the next one.